The use of CPR, or cardiopulmonary resuscitation, in end-of-life care is poorly understood as being an effective last attempt to keep someone alive. In fact, Dr. Charles Wright explains that the use of CPR has become widespread, but for all the wrong reasons.
The problem is, for reasons that are not at all understood, and in the absence of any evidence, people started using CPR in all kinds of other situations where the patient is dying. Knowledge on this, I think, comes from TV dramas where frequently you see patients in this situation and in comes the team and they put the paddles on the patient's chest and they zap it and the patient, suddenly wakes up, and the reality is very different.
The actual success rate of CPR is very low and is mostly ineffective for patients who are dying of chronic illnesses.
And you might say, well, that's strange. How can you say it's harmful if the patient's dying anyway? If it doesn't work, then that's too bad. Well, trouble is that sometimes it's partially successful and the patient ends up with brain dysfunction. It always causes fractures of the ribs and the sternum in the body. And perhaps, worst of all, in a patient who's going to die, it chases the family out of the room, and the scene is one of complete chaos, just at a time when the family most needs to be with the dying loved one.
So why is CPR so widely used in end-of-life care?
We've made the rules in many hospitals, either written or unwritten, that if there is not an order in the chart which says do not attempt resuscitation, then the patient dies, then the staff have to start cardiopulmonary resuscitation, even in situations where we know it's completely of no effect.
One of the most unfortunate results of these rules is what is called slow code, CPR that is given to a patient, even though there is no chance of success.
What can happen in these situations is that the staff start the CPR, but not with much enthusiasm. And that is, of course, a very unfortunate thing. I mean, it's completely absurd that the staff would have to be put in this situation.
And the only way to avoid these situations is to plan advanced care directives.
It's not only important to make these plans, but to discuss them with the family. Because although you can sign and seal these plans in clear language when you're of sound mind and you're perfectly competent, the problem is if you become incompetent, then of course it is your power of attorney. It is your next of kin who has to make the final decision.
For Evidence Network, I'm Mélanie Meloche-Holubowski.